Welcome to Basically Physio. Today we'll be talking about the phases of stroke recovery and the implications that it has on your rehab journey. Based on the International Stroke Guidelines, these are the definitions for the timelines for the phases of the stroke shown here. The interesting thing to note is that for the subacute stages, it is now split into the early and the late subacute phase. This graph here shows how a normal recovery journey can look like. Typically, there will be a steady increase from the acute to the late subacute stage, and then very gradual gains in the chronic to eventually plateauing in the chronic stage. Now let's take a look at the rehab goals in each of these phases. In the acute to early subacute phase, the aim of rehab is for restoration of functions. This means that we want to restore the way of doing activities as close to normal as possible. So the main goals will be to stabilize and start intensive rehab when medically cleared by the doctors, to verticalize as much as possible, and this can range from simply sitting up to standing to eventually walking. And lastly, to monitor for any signs of worsening of stroke and also to pick up any early signs of spasticity. In the late subacute phase, the rehab aim will still be for restoration, but we can also start to explore compensatory techniques. This means that we can modify the way of achieving certain goals by compensating through the use of an aid device, external help, or even just the stronger side of the body. The goals of this stage will be to continue verticalization as much as possible, to start reintegration into the community. This means we want to train the individual to live in the community after discharge by developing skills, to also focus on endurance type of training where possible and where required, and lastly to continue to monitor for signs of spasticity. In the chronic phase of the stroke recovery, the focus for rehab is less on restoration and more on compensatory, while also emphasizing that the maintenance of functions that have been recovered since the start of rehab is important. Now, the common question that we get is, what about recovery in the chronic stage? It is usually not the case to recover exponentially in the chronic stage because the neurological recovery may have already plateaued by now. However, via compensatory methods and use of robotics where deemed suitable, there is a chance of better recovery.